Pain from the neck or back is very common. 80% of us will experience this at some point. There are ways that we can protect these areas by holding ourselves in the way our spine was designed to be. This is called correct posture and is one area that your physiotherapist is always keen to address. This short film will demonstrate correct posture in standing, sitting and lying. It will also give examples of how to correctly lift. Following this advice can reduce existing back pain and protect your back for the future. Some new positions may cause discomfort while your back adapts to them. If you find that these changes are making your symptoms worse over a period of time, or your pain is spreading away from your back, seek further advice from your physiotherapist before continuing to follow the suggestions in this film. Our spine is shaped to support a small curve in the low back. This is important as it helps transfer weight to our legs when we move. If you experience pain in standing, it may be because this curve is too big. This can put increased strain on the joints, ligaments and muscles. To change this posture, decrease the curve by tilting the pelvis back. Watch how the belt line becomes more level. If you also hold the lower part of the tummy in, this will support your back. You should not hold your breath. This is an example of a decreased curve of the spine. The low back appears flat. As you can see here, the belt line is tipping backwards. Correct this position by tipping the pelvis forward. The belt line becomes level and a curve is produced in the low back. Holding in the lower tummy muscles can support your back. Do not hold your breath. Overloading yourself by hanging a heavy bag on one shoulder, in your hand or behind you, can strain the shoulders and the back. If a bag with one strap is held in the crook of the neck or arm, it will put uneven load on your body. Wear this type of bag with the strap over one shoulder and the bag under the other arm. Remember to keep your shoulders relaxed. If straps are across both shoulders, they distribute weight more evenly across the back and will put less strain on the body. The ideal bag is carried on both shoulders and the straps adjusted so the bag is held close to your back. If you have shopping bags, it is better to carry two bags, one in each hand, to distribute the weight more evenly. Your back is designed to move and not stay still for long periods. This is a slumped position. The normal curve of the spine is lost and the lower spine straightens. In doing so, there can be incorrect force on the lower spine. This, over a period of time, can stress the spinal structures and cause pain. If you sit on your hands, you can feel your seat bones. Gently rock the pelvis forwards and backwards. Sit upright and then slowly allow the pelvis to drop back. When you feel the most pressure on your hands from your seat bones, your spine is in a mid position. When you sit, it is best to sit in this position with your feet on the floor. This maintains the natural curve of the back. Until you have the muscle control and strength to control a correct posture, there are some strategies that can help. Sit in a good adjustable chair that provides lumbar support. This will keep the curve in your low back in the correct position. Move your neck to prevent stiffness. Take regular breaks and stretch your back. If the chair is not shaped to support your back, like this one, you can use a wedge to sit on to improve your posture. Using a rolled up towel in the small of your back helps to support the correct curve. Your feet should be on the floor or a footrest. When you sit in perched position, it causes you to lean forward. If you sit like this for long periods, stress across the back can cause pain. To prevent this from occurring, move your chair in close to what you are doing. Avoid overreaching and sit back in your chair properly. This will prevent your pelvis from tilting backwards. If your feet cannot reach the floor comfortably, either lower your chair or use a footrest. Your desk should be large enough to allow your forearms to rest on it when using the keyboard. Be certain that your keyboard and monitor are at a comfortable height. If you have to sit for a long time, you can gently rock the pelvis forwards and backwards to prevent pain. When lying in bed, our mattress should support our back. Pillows should be placed under the head to support it and keep a mid-position of the neck. It is important to use the correct number of pillows that will keep the head, neck and back in a line and parallel to the mattress. This can prevent pain and stiffness in the night or first thing in the morning. When we lie on our side, there should not be a gap between our side and the mattress. If there is, it can sometimes cause your spine to bend to one side. Over time, this can load the muscles, joints and ligaments and cause excess strain on them, resulting in pain. The ideal position for your spine is a middle position. It may be beneficial to put a small support under your side to maintain the spine in a good position while lying or sleeping. When lying on your back, the mattress should also fully support your spine like this. If the mattress is very hard, then there may be a gap between the low back and the mattress. Placing a duvet or topper on the mattress can also help to increase support. Alternatively, it may help to support the lower back with a lumbar support, pillow or rolled up towel. When the low back is well supported in bed, the muscles can relax. This can help to reduce pain and morning back stiffness. Your back is designed to bend and lift. However, if you lift repeatedly, lift heavy objects, or already have back pain, then bending and lifting may cause discomfort. You can help to reduce the strain on your back by following this advice. To pick up a small object from the floor, bend your knees and keep your back straight and lift like this. If you're unsteady, it's useful to use a stable surface to help you rise. Try not to twist or overstretch when you're lifting, as this can increase the strain on your back. When lifting larger objects, plan how you're going to do it first. Check the weight of the box and your path to where it will be placed. Remove any obstacles. Bend your knees, keep your back straight, and bring the object as close to your chest as you can. Use your leg muscles to stand up again. If you feel the object is too heavy, you should not lift it on your own. Sharing the load will reduce the strain on your back. If you are carrying the object a long distance, plan to do the move in stages. Stop and place the object on a steady surface for rests. When lifting an object that is not on the floor, stand near the object, reach for the object with both hands and slide it towards you. Bring it as close to your chest as you can and use your leg muscles to stand up straight, and try to avoid twisting.